Welcome to Currently Speaking, the podcast of the Current Consulting Group. I'm Bill Current, founder of the Current Consulting Group, and today we'll be talking with Brian Feeley, Vice President of the Current Consulting Group. Welcome, Brian.
Hi, Bill. Thank you.
So, Brian, why don't you give our audience a little bit of background, especially your technical background in drug testing?
Sure, be happy to. So I spent probably about the first 15 years of my career in the bench, really working in laboratories, a couple different areas. One of them that I probably have the most experience with is in assay development. So we're going to talk a little bit about immunoassays, and those are the things that are used to develop drug testing tests, for example. So I spent about 15 years doing that, and then rest of my career was really in oral fluid sales and marketing and business development, where I worked at OraSure for 26 years. So kind of quite a bit of experience with oral fluid drug testing on top of the technical background of developing tests in the past.
Perfect. Thank you. So this podcast is one in a series of discussions that we're having between Brian and myself about oral fluid testing. Today, we're going to talk about some more advanced topics. For example, Brian, what types of screens are used for oral fluid testing, and how do they compare to urine and hair testing?
Sure. So they're traditionally very much the same as what you do with urine screening. And I'll use two different methods here, contrast one to the other. There's your rapid tests, right, which we call point of collection type tests or instant tests. And those are typically done with what we call lateral flow technology. And it's basically a card or a piece of paper that's inside a cassette. And there's reagents that are built into that cassette to detect your drugs. So whether it's a urine screen or an oral fluid screen, they're designed very much the same way. And so we call those immunoassays or lateral flow immunoassay tests. In laboratory-based testing, oral fluid compared to urine, it has evolved quite a bit. When we first started to launch oral fluid testing at OraSure many years ago, we used something called microplate technology, which is more of a very sensitive technology, but heterogeneous and not necessarily the type of platform that the larger labs want to implement long-term for drug testing. Those labs typically use large immunoassay analyzers, and they're used to using those for urine screening. So today, most of the manufacturers are now beginning to make their reagents or have already made their reagents that will adapt to those high throughput immunoassay machines. But again, same technology that you use for urine screening, using antibodies, which is very fascinating to me. It's one of my passions is really the science behind the immunoassays, how they work, and then how the conformations are done. But essentially, that's how the screening is done in the laboratory or with a rapid test for oral fluids.
So how can an employer know that the result they're getting from an oral fluid test is accurate? Can they trust that result?
Sure. Yeah, good question. And I think, like any test, Bill, the consumer needs to do their homework. They need to understand who they're buying that test from. They need to be, checking with their provider if they're using a TPA or they're using another source to purchase those immunoassays. They need to be comfortable with the fact that they've done their homework, looking at things like the package insert that really specify how that test performs, what that organization, that manufacturer has done in the development of that test. And what I mean by that is really the clinical studies that were done, the results of those studies, and really just making sure that they've done their homework on the test, that it is accurate. Most of the manufacturers out there are trying to produce tests that are in that 95 to 100% what we call sensitivity and specificity range, and they compare their screens with things like LC or GC mass spec. That's an accuracy study, if you will. So how well does that test work versus the gold standard, which is confirmation? And they'll do those studies. And if they haven't done those, then you should beware. As long as they have that data and it looks good, then you're in pretty good shape. Nothing different about doing your homework on an oral fluid test that you would do on a urine test. Same checks and balances.
So the package insert is critical then. You've got to make sure that
Absolutely
what you're looking for is there. So maybe give our audience just a quick definition of sensitivity and specificity.
Sure. So sensitivity is typically the measurement or the characteristic of how low is that test able to detect the drug of interest, right? So how sensitive is it? The specificity is a measure more of um, your ability to detect that target analyte. So let's say it's THC, marijuana. How specific is that test for THC, or does it cross react with other things that might not be as specific? And sensitivity and specificity have basically measures things that you can look at, what we call false positives or false negative rates. So they're
Mhm.
telling when it comes to the degree of a false positive or degree of false negatives that a test might give. And manufacturers are very careful, at least the good ones, just trying to make that balance proper so that you don't end up with too many false positives. You don't end up with too many false negatives. Neither are good. But if anything, with most of these tests, you'd prefer to have a false positive that gets then forwarded to the confirmation step and just doesn't confirm. It doesn't come up positive on the confirmation. It's when you have a high degree of false negatives that can be a problem, because those are samples that are actually positive, but you're calling negative because the test is skewed a little bit too much toward that false negative side.
Okay. So let's say now the employer has a result. Can they act on that result from an oral fluid test?
So if you're talking about a screen, then absolutely not. So the screen is just that. It's not 100% accurate. It has a certain degree of false positives and false negatives, as we were just discussing. And so anytime you get a positive, you should consider that what we call presumptive or non-negative, right? And for you to take action, that sample or a fraction of that sample, whether it's urine or oral fluid, should be sent to the laboratory for confirmation testing. And that's what an employer should take action on, not on the screen. Now, I
So,
will say, just as a caveat, that some people will utilize a screen in a pre-employment setting, and they may do mass screening of people and come up with a range of positives and negatives, and they'll basically hire those people who are negative, and they may decide that they don't want to hire those that came up positive on that screen. It's a pre-employment screen. You're not really taking action. I feel like even those should be sent for confirmation, because if the test is wrong, you could be screening someone out that is a valid candidate. The test was just inaccurate. It picked up something it shouldn't have picked up.
so what type of test is done in the laboratory to confirm a result from a presumptive positive?
So those are that technology has been around for years, Bill. It's basically either GC, which is gas chromatography, or LC, liquid chromatography, mass spectroscopy. So it's a big word for, and a fancy word for, what is really an elaborate machine that is very, very sensitive and specific, and is really considered to be the gold standard when it comes to the confirmation of that sample. So it doesn't depend on antibodies that could have varying degrees of sensitivity or specificity. It doesn't depend on, a card or paper or lateral flow test. It is done on a mass spectrometer that is basically like a fingerprint. Consider it like a fingerprint. It's pretty much 100% accurate. If you've got cocaine in a sample, it screens positive, and GC or LC mass spec confirms for the presence of cocaine, then it's cocaine.
So, will the result hold up in court then?
So that's a open question. So of course it will, from a science standpoint and a toxicology standpoint. So if you're doing an oral fluid collection according to the manufacturer's instructions, you've followed it to a T. You've got your chain of custody. That's you followed to the T, and that sample goes to the lab, and there's no breach of the sample. There's no flaws. Then there's no reason why an oral fluid shouldn't hold up in court today, just as a urine sample would. Um, The only thing you have to be careful of course, is your state laws and the things that have nothing to do with the technology. It's more, should we have used the test in that situation or in that state? Did we follow the right laws and regulations, of which, of course, Current Consulting Group has a lot of expertise in. So I would say if it's not related to if it's more related to those things, then it could be subject to where they perform that test and how they did it, more so than the technology.
So I'm kind of gathering from everything you're saying during this podcast that one, the employer needs to do their homework, make sure the device or product they're using meets all of the qualifications for a good, solid test. Because if there is a positive and they do confirm it at the laboratory, and heaven forbid somebody challenges it, they're going to have to defend that result somehow.
Sure. And that's where also your laboratory comes into play. So the toxicology labs today, whether it's the big 3 or 4 or even some of the smaller regional labs, have certifications, and some of them are SAMHSA certified as well. Of course, the more you get into regulated testing and the deeper you get into things like DOT and federal testing, you have to be a SAMHSA certified laboratory to be able to do that sort of testing. In fact, most of the sort of larger workplace labs are SAMHSA certified. So, but even if they're not, they could have an ISO certification. They could have other state licensures that they've gone through, which is perfectly valid. And those laboratories can provide you with their packages that you can help go to court with. So they can basically back up your, if you had to go to court, they can back it up with a package that shows how the sample was tested, verifies the chain of custody, all the things that one would need for testifying in court.
So you want to make sure that whoever you're working with can offer that kind of support.
Yeah, absolutely. That's important for laboratories that are doing workplace drug screening.
Okay, perfect, Brian. Thank you very much. That was great information. If any of you would like more information about oral fluid testing, contact the Current Consulting Group, get a hold of Brian. We'd be happy to answer any of the questions that you have. And that's it for today's podcast. Thank you for joining us. Look for more podcasts from the Current Consulting Group at our website, currentconsultinggroup.com.